This community is very generous in thinking about how to care for the most vulnerable. Years ago, predates my tenure at ADAMH, there were a team of partners that came together and said we could do better. We had long lines of individuals with psychiatric needs presenting in our hospitals, and our community safety net was thin. And so we knew we had to do it better, we had to do it more efficiently, and we had to do and create a system that was filled with dignity, that was able to connect with an individual who was in crisis, was able to meet them where they needed to be, give them the treatment they needed to be, and support them on their journey to wellness. We were very fortunate to have the Osteopathic Heritage Foundation, the Columbus Foundation, and the Columbus Medical Association Foundation. They came together with the adult serving hospitals and ADAMH and first responders and said, if we could design the most ideal system for Central Ohio, what would it look like? And so we were iterative right from the beginning. We ideated about best outcomes for our community, and then everyone stacked hands. It wasn't just we agree on the vision. It was here's the dollars behind it. We're gonna stay at the table. We're gonna plan this facility. And we had those same partners at the table from beginning to end, which was about the span of 10 years. I think our momentum, the quality of our partnerships, and that we never lost our focus. We always kept it on the patient. We always thought about doing crisis care differently. Collaboration was embedded in this project from the beginning, and I got to come in at a really pivotal time where lots of our community partners had stacked hands. Well, the Crisis Care Center is a part of an entire crisis care continuum. We have someone to call, which is 988, someone to respond, which is our mobile crisis response teams, and ultimately, somewhere to go, which is the Franklin County Crisis Care Center. What we say is, if you are living with a behavioral health diagnosis or you have a crisis, we're gonna treat you with the utmost dignity and full wraparound care, just as we would if you were having a medical emergency. I think the Crisis Care Center is a model of what we in Central Ohio do when we stand up for the most vulnerable. This is what we do when we come together. We respond appropriately, we strategize together, we think through things, and we don't just plan, we execute. And we execute on behalf of the everyman in Central Ohio. I would say to the many partners who turn this vision into reality, thank you. Thank you for your courageousness, your tenacity, for your stick-to-itness. We got it done, and there's more to come.